Good morning. Can you tell us what an electronic medical record is?
So good morning. Yes, an electronic medical record is actually what we call digitalization of the patient's chart. So it's the opportunity for us to document the care that we deliver, the service that we deliver, right into an electronic chart that will be available for everyone's use.
Well, I just add to that it also gives us much more timely access to records on an as-required basis. So the clinicians have got direct sight of the information that's relevant at the point of care.
And how long has this process been going on?
So the process that has begun from when we initially planned it has been about 3 years now. But the actual implementation has been more about 18 months.
That's correct.
When we initiated this in April of 2021, and we've kept pretty much to the schedule that was set out at the beginning, with a design phase, a build phase, a testing phase, and then laterally we've heavily involved in a staff training phase to get us to the very exciting point of go live, which is now less than 48 hours away.
24 hours.
How have staff responded to the change into electronic medical record?
So we involved the staff from the beginning, the phases, and initially it was a small group to do the build phase and then the testing. But as we started moving further testing and the training, we involved all the staff. So we actually had to get everybody who will be using the staff. So it's about how many staff we have totally?
It's about just under 1,800 staff.
1,800 staff to get them fully trained before they even can use it in the go live. So the staff have been involved and increasingly involved. Excitement now.
This is a very important question to answer because it's been a real team effort right from the beginning. About 350 of the staff were involved in the design and build, and as we get towards the implementation, over 90% of all of our staff have been trained, which is in excess of 1,400 to 1,500 of the staff, which is an amazing achievement.
So what can patients expect once the electronic medical records has gone live?
So what they can expect to see is more time efficiency. Also, their records will be more available for the clinicians that will be looking after them. We won't have to go get a paper chart anymore. Everything will be right there at the push of a button, and the clinician, it will save time. Also, if they have a referral that has to go to another service provider, they would actually get that information ahead of time so that the clinicians are prepared for the patient. So they'll see more time efficiency and more getting to know. Also, one thing is I joked with a friend of mine, when you come to the emergency room and you say, it's already in my chart, it's actually, the chart is right there at their fingertips. We don't have to go to medical records anymore. It is right there. So they'll be able to see that, but also in phase 2, once we get through this first phase, we'll be doing what we call a patient portal. So they'll be able to have access and see their own results in their own chart. So that's to come as well.
The only thing that I would add to what Lynnette said is that this strengthens the quality and safety of care by the very fact that all of the relevant information is available pretty much at the fingertips of the treating clinician. It also has the facility, which we're delighted with, is that many of the alerts and such things as drug allergies are readily flagged in the system, which improves the quality and the safety of the care.
Can you just discuss or explain about the confidentiality of patient records? Since everything's now electronic, how are you going to secure and keep records confidential?
So at the moment, even before we go to this electronic formatting record, all our staff sign confidentiality clauses that they have to sign and they stick to. But also, each staff member will have a unique user ID with a password and also with their badge. That's what they'll use, and if they're accessing it within the hospital, they'll just have to be able to sign in with that user ID and the password. If they're outside of the establishment, saying remotely in from home, there's what they call two-level authentication that they will have to do, so to ensure that it is secure. But also with this electronic medical record, we're able to timestamp and record everyone who signs into any part of any trial. Also, as part of our build, they have to establish a relationship with the chart. So it's based on their profile what they'll be able to access, but they must establish a relationship to say that they will be treating that patient, and that's how they will gain access as well.
There's nothing I've got to add. Comprehensive.
Are there any final words you would like to share with us?
Yeah, there are a few things that I would like to say. Is that much of the Western world has already moved on to the use of a digital platform. This is the direction of travel. As the explosion of information that's taken place really in the last 4 to 5 years, the only way to keep up to the available information is to have a digital platform. The second thing is that this allows us to remain coupled to the healthcare providers, particularly that we use and link up with in the eastern coast of the USA. So we retain, this is where modern healthcare is going in the management of information. The second thing is that our legacy systems that we previously depended on were in actual fact, they were sunsetted, they were orphaned. So not only was this a desirable direction of travel, it actually was an essential direction of travel for BHB at this time. It's been a huge project, and when I say a huge project, it's required us to implement this at a difficult time, because we initiated this through the middle of the COVID pandemic because we had to. And I can only thank the staff sincerely for putting their shoulder to the wheel yet again to help us deliver on this project. It has required many individuals to go over and above their normal working brief, and I, as the CEO, am extremely grateful to them for that. But also on top of that, there is something unifying about having a big project to deal with, and there's been enormous energy that's been created through the process, getting towards what can only be described as a degree of excitement that we are about to execute on something that's been in the gestation for quite a while now. And so we go forward to Saturday morning with anticipation. The other thing that I would just add is that we ask the public to give us some patience in terms of, as we familiarize ourselves with the way that the system works, that there will inevitably be a little bit of a slowdown in activity, and this is to be expected. Many of these have been put in place around the world. I personally have been involved in one in a previous jurisdiction, but this is short-lived, this slowdown in activity, and we expect to be normalizing the activity within the first 2 to 3 weeks.
And I support everything that Dr. Richmond has said, and also that this is an opportunity for us to unify our systems, our team, as we improve on quality and safety for each individual patient. And it's been a labor of love for most of us. I would say all of us, not most of us, all of us. And it's something that we've been looking forward to for a while. So I just want to say thank you to the team at BHB, because some great things have come out of it, and teamwork is one.
And then can you also just tell us, what does PEARL stand for?
So PEARL stands for Patient Electronic and Administrative Record.